Dr. Nell Thomas is a family physician in Minden. Dr. Thomas has spearheaded a campaign of three billboards and a website, all on the topic of heat health. And Dr. Thomas, we thank you very much for joining us today. Thanks for the time.
Oh, my pleasure. I'm thrilled to be here. Thanks for asking me.
Well, I would like to start by finding out a little bit about this billboard campaign. How did it come about, and why has it been undertaken at this point in time?
Very good. So the billboard concept came because I was driving my mother to her monthly eye injection appointment in Lindsay. And I remarked that there were a number of blank billboards offering advertising space. And I thought, what a great way to offer people critical health information as they're traveling. Passengers can check out the website. They can read and talk about their own health risks from climate change and review the resources while they're otherwise killing time in transit, or as I like to say, captive audiences in their cars. So a roadside billboard reaches anyone and everyone. And the more people who are informed about health risks from the warming climate and our warming planet, obviously reduces demands on healthcare services, emergency services that are all very stretched. So rather than show up in the emerge department with, heat stroke or trouble breathing from poor air quality days or West Nile virus, people can find resources and become educated from the information on the billboards. So my idea was to be able to catch people while they were otherwise not engaged with other activities.
Now, you chose three billboard locations. Maybe you could talk about where they are and why they're where they are.
Sure. So initially, when I reached out to the company that you rent billboard space from called Stellar, and you just phone them, they're on the bottom of all the billboards. I discovered that if you want to rent one in Southern Ontario, it's about 3 times the amount of money. So the further north you go, the less expensive are the billboards. And I realized that, it's based on the number of cars that go by, the number of viewers. So it's all done algorithmically and statistically. However, I was also concerned about rural areas and the north. I am a northern person, and I'm also connected with the physicians and healthcare group in Sudbury and a part of the Northern Ontario School of Medicine in Sudbury. And Elaine Blacklock is a significant player in the Northern Ontario School of Medicine climate change group and an activist and an author up there. And she thought also this was a great idea. So it made sense to put one billboard in Sudbury. So there's one northbound on Highway 400. As you're approaching Sudbury, it's up high on a hill on a rock cliff. I haven't seen it myself, but I've seen a picture of it. And then another billboard is westbound on Highway 60, just east of Huntsville. And again, I'm connected to and affiliated with the physicians in the Huntsville-Muskoka area. So that made sense for me. And then obviously I live here in Haliburton, Minden. So there's a billboard that is southbound on Highway 35, just north of Carnarvon. And each of these billboards is very direct. And the message is very clear and easy to see. It was designed, so the logo is designed by some professional marketers that live here in Haliburton. Roger and Barb, and I'm trying to think of the name of their company. This is terrible, but I can't think of the name of their company. So they do a lot of promotion and marketing, and they're amazingly talented. And so they came up with the image for the billboards.
Now, you obviously have placed a goodly amount of your own money behind this campaign. This is not a cheap undertaking by any means. Who else is in behind the campaign and supporting what you're doing?
Yeah, so I did reach out to the Canadian Association for Physicians for the Environment, and they thought it was a great idea, but didn't have the resources necessarily to back it. Also reaching out to some other medical groups, the Canadian Cardiovascular Society. These are not organizations with lots of capital. I'm very pleased to say that Environment Haliburton, so our local environmental group here, headed by Susan Hay, currently president of the EH. They have donated money for this and highly enthusiastic about the project, I'm pleased to say. Yeah. A few of the local doctors, so a couple of the local doctors have participated, I guess I'm allowed to say. So Dr. Norm Bottom has donated some money, and Dr. Keith Hay has donated some money. And I think over time, I think the doctors probably, and obviously Dr. Elaine Blacklock. So there are a few key physicians that are very much supporting financially. It is a large, expensive project to rent billboards. So for a year, right? So they're rented for a full year.
Wow.
Mm-hmm.
Now, people driving are going to see these billboards and hopefully go to the website. And is that the key element of the billboard, to drive people to the website that
To the
you've
website,
developed?
absolutely. Absolutely. That's what the purpose of the billboards is. So then once you go to the website, what is it? It's a landing place. It's a place to find health and safety data for weather and climate change. And there's a lot of, as you say, meat. I think we were chatting earlier and you said lots to chew on there. My husband refers to as very dense. There's a lot of information on this website. I've consolidated from government websites, science websites, Red Cross websites, all sorts of resources, bringing together into one location the information that people need for air quality, tracking wildfires, assessing the air quality for safe days to go outdoors if you have lung disease or heart disease or asthma, tracking wildfires, as I say, but also tornadoes and floods and extreme weather. So there's all sorts of apps and resources for people to use. But it's also categorized. There's 6 main icons on the website. So the resources are all there and organized, even though it's dense and there's a lot of it. You definitely will be able to sort through and find what's relevant to you. So if you've got kids and you want to understand, what are the risks for heat stroke and how to reduce those risks, sunburns, how to manage kids. There's sections for pets and older folks, elderly. There's information about mental health and climate change. There's information about the workplace and rules and regulations around what safety information do you need to have to keep you safe on the job. There's safe water quality, and there's a whole section on food and why we need to pay attention to where we get our food, what we're eating, how we manage food waste. All of that is relevant to a warming climate. So there's many different components to this, but a lot of it is really about, finding what's personally relevant to you and your family.
Well, when I looked at the website and I was both impressed and taken aback by the amount of information that's available. And I thought, well, if I was to take all this in, and if I was to digest all of this, I hope you're going to give out diplomas that go along with it. It's like taking a university course. It's just a tremendous resource of information.
That is true. So what it does is it brings together in one location all of the other links, public. Oh, that's another support we have here is the public health. So Kawartha Public Health Unit has also provided some links and resources. So really, if you wanted to find out something and you just really weren't sure if it existed out there, you wanted to look for some information about the changing weather and climate change, and you weren't sure if the information even existed, I can tell you that you go to heathealth.ca, and on the heathealth.ca, you maneuver your way from, the initial categorized headings, and then you move through the well-organized links under the different subcategories, and you find what you need. So how to keep your home safe from heat, and how to keep your home safe from flooding, tornadoes, extreme weather. So there's a whole section on protecting your home. As I say, apps for tracking air quality, storms, fires, floods, all of that. There's a lot on how to create an emergency response kit, what you should put in your emergency response kit, how to keep your family and pets safe. And, you know, there's information about power outages and road outages, basically anything that would be relevant to you, your family, your home, your work life, that's related to a warming planet.
Well, over the next few weeks, we're going to cover each of those major sections. And I thought tonight, if we just take a little focus on the section called Where We Live, and that drives you into a portal that then has all sorts of other information. But rather than driving down into all the data, what would you say is the takeaway from the section called Where We Live?
Yeah, I'm thinking that's the part that talks about human migration initially. Is that, yeah, you'd think I'd know. So each of the 6 main sections starts with a little preamble, a little background, or I guess you could say. And so, for example, the section on water and food, you know, talks about water shortages and food shortages, and then things like blue-green algae and safety around, you know, toxic water and things like that. So we in Canada are not it's not as in our face as it is the heating climate in much of the world. So, you know, hundreds of thousands of people and millions of people soon, and perhaps tens of millions and hundreds of millions are going to be on the move because their immediate environment is no longer habitable. It's too hot. There's drought. They can't grow food. Water is not safe, etc. So I'm not sure if that's the section that talks about Mexico City. They're anticipating that, you know, 22 million people who live in Mexico City are going to be without tap water this month as they are running out. They call it day zero, when a city ends up without water. And there's been a number of cities around the world that have faced this exact scenario. So the section that you're referring to, I think the preamble is talking about the number of climate refugees and forced immigration and people on the move. So we talk about animals that are on the move, you know, obviously fish and birds and critters that can move are moving north to get into a habitable environment because their immediate worlds are too hot. And even plants are moving north. We're finding things growing in the far north that haven't grown there for a long, long time, certainly not in human lifetime, because of the warming climate. So we talk about what's imminently going to be facing the significant portion of the human population, and that is uninhabitable homelands. And that's, I think, how that section starts. And then in every section, as I say, there's a preamble and then there's links. So there's informative educational links that are subcategorized. And I believe in that section, there's a lot of links around keeping your home safe, how to make your home less vulnerable to wildfires, and how to make your home less vulnerable to tornadoes and floods, and also greening your property, how to keep your house cool, those types of things, I think is in that section.
It's very, very useful, the information, and so pertinent. I think all of us can appreciate what's happening with climate change as it relates to people having to move from one area to another, and we're starting to, as you point out, reading that there's things, spiders that we've never seen before that are as big as a breakfast plate that are starting to move up towards Canada. So there are changes afoot, and your website goes a long way to helping people understand what they can do with these changing times. And I think, Dr. Thomas, in the coming weeks, we'll cover some more sections, but I think this initial chat of ours is really to urge people to go check out heathealth.ca. Pretty simple, but really a tremendous, tremendous website, tremendous support to people everywhere, not just in the Halliburton Highlands. This is
Oh,
a
certainly.
website that has
Yeah.
a lot of legs.
Applicable. Yeah. So you're talking about mosquito and tick-borne diseases and viruses. There's a whole section on that as well. Yeah. As we are seeing more of the traditionally southern insect and yeah,
Oh
more
boy.
viruses that yeah, I know. Obviously, we're well familiar with West Nile and Lyme disease, but there's other illnesses and diseases that are going to be moving their way north. And there's a whole section that talks about that. So a lot of these resources coming from government websites, public health websites, yeah, medical websites, and
Mhm.
all highly reputable, all science-based, all very reputable data. So people can rest assured there's no agenda here except to keep people safe, to inform people, and to make it all available at their fingertips.
Dr. Thomas, thanks for joining me today. It's been great chatting with you. We'll look forward to the next conversation. We'll cover off some more topics coming out of heat health and some other topics related to the climate as well. Thanks very much for joining me.
Terrific. Thank you for having me.
Dr. Nell Thomas is a family physician from Minden, and she has spearheaded a campaign of billboards and a website, and you can go enjoy it right now, heathealth.ca. Please go have a look.